Welcome back. We are answering your questions today about the coronavirus with Cone Health Medical Group Family Medicine Physician Dr. Zoe Stallings. Remember, you can text your questions to 336-379-5775. A lot more questions just coming in here the last couple of minutes, Dr. Stallings. The first one, is it possible to have the full-blown virus and never have a fever?
It is possible to have the virus and spread it to others, and you may never show a symptom at all. You may never have a headache, a body ache. You could be perfectly fine. In fact, some of our patients who are going in for elective surgery, it could be a knee surgery or a transplant, who feel great. They get a pre-op test and it's positive, and they had no symptoms. So that's why it is just so important to wear your mask, because the most dangerous ones are the ones who have no symptoms. The people who are throwing up and the people who have body aches and are wheezing, they know they're sick and they stay away. But the people who are fine, that feel well, in fact, some people say, my appetite was great. I didn't even know I was sick. Those people can spread it to so many more. When we do contact tracing, it can come from the healthy person who had no idea. So protect yourself at all times. Keep your mask on in public spaces and not gather or visit others.
Somebody asked, any idea when the regular average person will be able to get the vaccine? I know that there's not a specific date, but is there a ballpark range?
So I'm just I don't know if you can see it, but on the website for Cone Health, there is a really wonderful tool. If you go on there, you can type in conehealth.com. There's a section called COVID-19 vaccine, and it actually shows you these phases, and it will tell you and be updated as to when the phase is going to be one that you'll get it in the community. But their phase that they're using is based on North Carolina's phased rollout. What that means is that you'll be able to see a progression. And so we're looking at starting with healthcare workers and working our way through those at the highest risk. And that will take several months. So it could be late summer. I can't predict a month or tell you a date, but you can always stay updated on that so that you can know where we are in terms of the phases. And the best way to do that is to go online to conehealth.com and search COVID-19 vaccine, or check with the state of North Carolina and also the county website. The health department updates that as well.
So bottom line here, there is no set in stone timeline for this. We're all just kind of playing it by ear as we roll out these vaccines.
Absolutely.
Someone said, was told by a doctor I can never take a flu shot because of a reaction to something in the shot. Will that stop me from getting the coronavirus vaccine?
No, in fact, I just spoke to my neighbor, Choice, who has latex allergy, and she's fine. The thing is, if you have latex allergy, an egg allergy, or you got a rash from a previous vaccine, you're safe to take this vaccine. What we just want to know is, what's the level of your reaction? So let's say you have anaphylaxis. That's where your throat closes and you can't breathe and your tongue swells. Now that's a serious reaction that's life-threatening. It doesn't mean we don't give you the vaccine. It means that we talk about when and where you get the vaccine, and we discuss the risk factors. But there are reasons that people might be excluded. However, this is not a live vaccine. It is not the one such as some of the chicken pox and the ones that you get when you're a baby. This is a vaccine that's just going to help your body make cells. So your reactivity and how you react to it can be solved by taking Benadryl ahead of the vaccine. So it's really important that you think about, what is my reaction? And if your throat didn't close up, you could probably be safe, but talk to your doctor about it, or when you go to the pharmacy. Once it's globally available, that's your pharmacist can advise you. But in the meanwhile, there are very few contraindications. And if there are any reasons not to get it, that will be discussed before you're injected. They always review those with you.
How long after somebody gets the vaccine will they get up to that 95% protection?
So with most vaccines, it takes your body time to react. So it can take a few weeks for you to make those helper cells that we need to boost our immune system. So the same thing for the flu vaccine, pneumonia vaccine. I always say it's not immediately going to create this protection. Your body needs time. So I often say, give it about a month. And I generally say, even with this vaccine, you still need your mask. You still have to wash your hands. You still have to maintain social distancing. The only thing the vaccine is doing right now is helping us for the future. It's not going to help us in the present, So we want to get as many people vaccinated as possible, but the mask won't disappear. Hand washing won't disappear. And then making sure that you are, staying home when sick, that's going to continue.
I'm going to fit one more quick question in before our next break. A popular question today: can I go visit my parent in a nursing home or hospital if they get the vaccine?
So if they get the vaccine, it depends on the policy of the nursing home. You'll still have to maintain some social distancing. So you may need to be screened at the door before you go in. The vaccine doesn't offer 100% protection, and these are highest risk people that you're visiting in a nursing home. So you'd still need a mask to go in. You may have to space each other. They may have to be away, maybe don't hug in, but it might improve your chances of visiting in the future. That's to be determined on A, how people are responding after we give a large amount of people a vaccine, and B, what are the precautions that the nursing home has in place.
Okay, Dr. Zoe Stallings, thanks so much always for your expertise. We'll be right back.